Social justice means that we are working to give people a voice who don't have a voice or who don't have power, that we are representing them and trying to ensure that in our society that people do have equal opportunity to succeed. And so social justice means that we're working towards making the place more equal and more fair. What social justice issues need to be addressed and rectified right now in our society? I think that when you think about it, it's the same issues here in the US and Canada, in Europe and Africa, as that we don't value other people. And so when we start to set programs, when we give people access to health care, when we give people education, all we do is to ensure that we have it and we don't really care about anybody else. And so to me, social justice is again about ensuring that people who don't have anything, that we treat them the best and try to provide them with the best. So that means either the people who are migrating from war-torn countries, that we don't blame them for all the ills that we've created. That means that people in poor neighborhoods, whether that be Flint, whether that be parts of Cleveland, East Cleveland, that we don't blame them, that we actually work hard instead of perhaps spending $1.3 million on a dirt bike path, that we actually put that into education or to actually cleaning up their housing so that they don't have lead paint in their houses. I think that currently in healthcare, the way we're addressing it is by finally understanding that lots of things affect health, so that if you live in a house that has lead in it or that has broken windows or that has mice, that could affect your health. It could affect your ability to do well in school. And if you don't do well in school, you don't get a good job, you don't get health insurance, you can't keep your health up. So I think there has been a recognition that all of those things matter. I think it's been a recognition that the things that we've done in the past to keep people from safe and lead-free housing, like redlining, has affected people's health. I think what we need to do, though, is that we need to start trying to fix it. And so we know that actually lead affects the mother, and it affects the grandmother, and it affects the grandchild, and it affects infant mortality, but we're not focused on that. And so in Ohio, we passed a bill and a budget that focuses on decreasing infant mortality, but lead is not one of the main focuses, even though we know that it affects infant mortality over generations. And so I think what we really need to do is take the lessons that we've learned and start putting that into practice. So how do diversity and inclusiveness connect to the work of SJI? I think one of the most amazing things about SJI is that they try to include a lot of different people with a lot of different perspectives and backgrounds. And what is nice about that is that we're all able to come together and to start talking about how to fix problems, or how to at least educate people about the problems that are in the surrounding community, whether that's Cleveland, East Cleveland, University Circle. So I think that's one of the most important parts, is that, you know, diversity is about excelling, bringing people together with different perspectives to formulate policies and plans to address problems. And I think SJI does that.